Headaches and migraines are commonplace in our culture. There are people suffering all over the country, not only over the country, but all over the world with headaches and migraines. And it has become very normal. And what do you do for it? You reach for Tylenol, ibuprofen, and you temporarily get rid of it until you get the next one. There's no discussion about why do you have that headache and that there are different types of headaches and migraines and that they could be telling you something. They could be red flags about what's going on in your body. And if you don't listen to it, it could get worse. So pay attention if you're that person who's suffering from headaches and migraines. And before you reach for that Tylenol and ibuprofen, listen to this podcast. So there are different locations for headaches. We ask people about their headache and they look at me and they say, yeah, I get headaches every now and then, but it's okay. I take an Excedrin or I take a Tylenol and it comes and it goes and it's fine. Or they sit there and when I ask them what type of headache they have or where it's located, they look at me cross-eyed. Yeah, it matters. It matters where your headache is located because that's going to tell an East Asian provider what's going on in the body. Where is it stemming from? What's the cause of it? So let's break it down. There are several different types of headaches or migraines. When we think of a headache, we think of something that's minor. We don't think of it having any auras or other symptoms that are accompanying. Migraines tend to be more severe. They tend to have auras, i.e. they see lights or they see spots or they might have nausea. They are heavier, sharper, and cyclical, things of that nature. They can also last a lot longer. So we want to talk about the two differences, but I will say there still are a lot of similarities between the two in regards to treating it through East Asian medicine. When it comes to migraines, there may be a neurological aspect to it, which is going to make it a little bit more intense, a little bit deeper, and a little bit harder to treat. But it actually can be treated, and not only can it be treated, but you might have immediate relief getting acupuncture. It's one of those diagnoses that when you walk into my door and their chief complaint is a headache or a migraine, I smile a little bit inside because I think to myself, this is one of the easiest things for us to treat. People come in with one and they leave without it. It is one of those chief complaints that has acute, immediate results. And over time, with treatment and an understanding of what's triggering it, we can actually get rid of them forever. I know it sounds crazy, but it's true. So with any kind of headache or migraine, we want to know the location. There's frontal, which is on the forehead. There is temporal, which is on the side of the head, kind of by either side of the eye. There is a vertex, which is on the top of the head. There is the back of the head, which is right occipital. And then there is whole head. So first we're going to start with the frontal. Frontal headaches relate to the stomach channel in East Asian medicine. The stomach channel runs from the forehead to the jaw, to the neck, through the front of the body, and it goes through the stomach. It correlates to the large intestines and all of the intestines, in fact. And it also goes through our ovaries, and then it goes down towards the top of the shins and to the toes, second, third toe. That's a big channel and it covers a lot of stuff. So frontal headaches are very common, which is why you always see people grabbing the front of their head when they have a headache oftentimes. The important thing to understand with this too is recognizing when it occurs. Oftentimes headaches are cyclical and they happen at certain times, especially during your cycle. Headaches are very common with women and females who are having a cycle. And when you have that frontal pain that correlates with your ovulation or with your menstrual cycle, then you can pretty much be sure that something's going on in regards to ovaries, in regards to hormones, and we're going to need to address that. Also pay attention, and this is the big one for all headaches and migraines, and I think people do connect to this, but they maybe don't realize how much what you put in your body, what you eat. So the intestines or in the stomach channel relate to the frontal headache, and that headache might be related to a pH imbalance, acidity, things of that nature. When I think gut and stomach, I'm really looking at that. It means your flora is off. It means that you're acidic. It means you're inflamed. Something's not metabolizing, digesting, and you will have headaches that are frontal, and it will usually correlate to something either before you've eaten, after you've eaten, and you're going to be very mindful about also the skin around those channels. Sometimes on the chin, you'll see breakouts, acne. As I've said in the past, the skin is a way for us to vent out toxicity, and it still will come out even along the channel or the organ system that it's related to. So when you're getting that along your chin, that's the large intestine channel, or you have some stomach channel there too. And then you're going to notice that it's going to be coming out, especially around pubescent ages and menopausal ages where hormones do play a part. They do connect to the stomach channel. Pay attention to that. When you think of a temporal headache, that's on the side of the head, and that is related more to what we would call the gallbladder channel. The gallbladder channel is the channel that works with fats. It's about metabolizing fats, and it does have a very close relationship to the liver. So you always want to pay attention to what's going on for a gallbladder or the liver channel around the time of day. So if you are eating things that are very fatty, processed fats, fats that are from animal products, if you have trouble metabolizing those, you are going to have what we would consider like a damp heat presentation and more oily skin, sometimes even behind the eye, and with other symptoms that relate to nausea. These are the very classic migraines that occur because it's deeper. The liver gallbladder does relate to hormones because, as we've said in the past, they're fats. Hormones are fats. And when our livers and gallbladders are at capacity, when it comes to cleaning out the toxicity, things that are hormone deregulating, those are going to really interfere with our liver gallbladder. This patient is also going to have issues sleeping. They're going to wake up sometimes between either 11 and 1 or 1 and 3. 11 and 1 is gallbladder and 1 and 3 is liver time. And this person is going to be sensitive also, maybe drinking alcohol. Alcohol obviously affects the liver, and so does sugars, and so does anything processed, like I said already. So any preservatives, any hydrogenated oils, things of that nature, you're going to run into some problems, and it's going to manifest this way. And what we were going to do is have to address the liver and the gallbladder. This is a metabolic cleanse. This is where those acupuncture points come into play, and they help tremendously. And detoxing, cupping, and eating foods that obviously reduce all of that. And then the problem with the liver is once it continues to get backed up, it's hard to metabolize all that out. You have to really be clean. You have to be eating things that help address and clean out the liver or gallbladder. There are supplements that can help with this. You need large B vitamins to metabolize this, to get it out of the liver gallbladder from a fat attachment to a water-soluble version in order to get it to go out of the body. So oftentimes people take a quick little liver cleanse, take a few pills, and then it feels okay, it feels a little better, it just sort of jumps into the bloodstream for a minute, and then it just shunts back into the liver gallbladder after that because it hasn't been properly metabolized out, which has to be done with a diet shift and with other supplements as well. So either way. The third migraine that I'll address is the vertex headache. This is pure liver. This is fatty liver. This is severe liver, more intense than the gallbladder in regards to addressing that migraine or headache. So this is where we definitely need to clean the system out. A metabolic cleanse is where I would start. And then we will talk about some herbs, and then we will change your diet in an effort to really support the liver. There are supplements that can do this as well, but that is purely liver. When you look at the back of the head, you have the occipital headache migraine. To step back to when it comes to the gallbladder channel, I know I mentioned the gallbladder, but that can be structural as well. One of the most common headaches that are structural are the occipital headaches, the ones where you feel on the back of the head. That is where your levator scapula inserts right there at the back of the head. And right now we are in this culture of phones and driving and TV and computers and working, sitting, and all of us are going to fight and combat this positional migraine, the migraine that is where you are sitting and your head is forward and you're putting strain on the levator scapula, which attaches to the occiput and then back to the top of the scapula, your shoulder blade. And when you are sitting in that forward movement, it really is hard to kind of get it back, and it's fighting and it causes tension and it really pulls and it hurts right there on the back of the head. So very commonly structural, especially if you feel it one-sided more than the other. If there's a facet irritation or if you have misalignment in your cervical spine, oftentimes this is going to cause sort of anything that's ipsilateral, one-sided, is oftentimes a little more structural, I find, but not always, but it can be that way. So you'd want to release those muscles. So thank goodness for the acupuncture needles. I've spent many years in deep tissue, and deep tissue is good, and that can be helpful. And sometimes you need it in addition. But I just personally like to go in there and release that muscle with the needle and be done with it. If that doesn't do it for you, like I have said in the past, having a team. So oftentimes people respond very well to massage. That's all they need. They're good. They leave, they're better. Oftentimes you need acupuncture, again, to go and release that muscle. And then for some, you need both, because getting the big muscles and then the small muscles and the relaxation of it. And then some need all three, the trifecta, which is chiropractic. So I personally recommend doing the acupuncture first, massage, and then the chiropractic. And now you can get it realigned. This is really good if you have very chronic headaches and migraines in this way. If you're misaligned in your neck and you've been this way for years and it's chronic, your body's going to want to switch right back into its misalignment. So, for example, myself, I actually had birth trauma. So some people have birth trauma where the baby is caught on the way out of the birth canal. That was me. My head was caught. I had no idea. I spent my whole life with neck pain. I remember in second grade with my best friend, and she was actually Chinese. She actually taught me LI4, which is a point for headaches. Interesting looking back now, but she and I would sit there and try to release our necks in second grade, and I had no idea that that wasn't the norm. I also couldn't sleep on my back because I was always misaligned, and even my mother said I slept better as a baby on my stomach, and it's because my neck was out of alignment. And it wasn't until I was late in my 20s and I started getting all these treatments that I got in alignment for the first time in my life, and I could sleep on my back, and all of a sudden it was this aha moment, and I was so relieved. Of course, with that neck misalignment, I had headaches. That comes with it. So I spent most of my life, young life, with headaches, misalignments, and I was a dancer too, and I was always out of alignment, which affected my turns. Just a little side note. But just understand that that channel on the back that goes into the occiput is the urinary bladder channel. So every channel relates to not only the muscular, but it also affects the internal in regards to the channel and where it aligns along the body, but also to the organ system. So mindfully understand that the urinary bladder is a channel that relates to the urinary bladder organ. And that organ system is crucial in getting toxicity out of the body. We metabolize our hormones and toxicity, fluids, estrogen specifically, through the bladder. When you want to test for your hormone metabolites in regards to estrogen, the urine is where you really want to check that, because there are many ways that we metabolize estrogen, and there's some ways that lead to healthy benefits and are the ideal pathway, and others that actually can be triggers and contribute to cancer. So metabolizing estrogen is crucial, and the way we get it out of our bodies is through the bladder. And when there is any sort of hiccup, backup, excess, we will feel it in the channel that correlates to that organ system. The bladder channel starts at the occiput. Well, actually, it starts in the eye. So oftentimes this version of headaches and migraines will also start in the eye, but instead of towards the middle of the eye, oftentimes it's more on the inside of the eye. Sometimes they feel it in between the eyes, or they feel it one-sided. For systemic issues, you will feel that there. It wraps around the head, comes to the back of the head, right at the occipit where those muscles attach, the levator scapulaire attaches, and then it runs all the way down bilaterally, both sides along the spine, down the back of the legs, including the hamstrings, the biceps femoris, which oftentimes will get tight, and then through the calves and to the side of the foot on the pinky toe, if you will, the fifth metatarsal. So no, that's another very large channel. And this is where yoga is our friend as well. So I understand there are a lot of people that don't think yoga will help in regards to weight. And that's not true. In fact, having that pathway open and getting your hamstrings stretched, that is going to help metabolize our fluids. And oftentimes, especially with women, there's water weight gain, which relates to this hormone imbalance, this deregulation. So downward dog and all the stretches that come straddling and all these amazing positions that get us out of the standing position that come with yoga is sometimes the only way, other than the needles and releasing the points along the channel, that I know of to release and move the fluids along that part of the body. So the urinary bladder definitely relates not only to systemic issues related to the cervical spine, but it can relate to metabolic issues that specifically relate to estrogen, and they can connect and relate. And what another little thing I just want to say is that the hypothalamus sits in the brainstem, which is on the base of the spine, which sits around that same location as well at the occiput. So if there is anything that is misaligned at C1, C2, that directly relates to the hypothalamus, which is our hormones and our temperature regulation. So this is important to notice around cycles, certain times of your cycle. If you're having infertility issues, menopausal issues, this is a crucial point to get aligned, and it will help with acupuncture, massage, yoga, and chiropractic, all the above. And before I finish up with the urinary bladder channel, there is one more pattern that can lead to a headache or a migraine from this part of the head. And that is related to what we would call a wind cold. The wind cold, or an external pathogen where you're out and it's windy and it's cold and you get sick, that will come in through what's called the wind gate. And the wind gate is right in the cervical spine at C7. It's the back of the head, back of the neck, and that will cause a headache when you have an early onset of being sick or getting a cold. So that's the wind cold. Finally, the whole head headache migraine. So the whole head is the kidney channel. This is, I think, first time I hear this, when someone's having a whole head, we have dehydration. So the kidneys obviously are the organ system that filter our fluids as they leave the body. They also helps the cleaning out our bodies. It also relates to our regulating our fluid metabolism. So if we are dehydrated, this is the kind of headache that you're going to feel the whole head. Another thing to consider is that right there on the kidneys are our adrenal glands and adrenal fatigue. So if you are extremely exhausted chronically, you will have this kind of headache as well. It is the whole head, and we will have to address the adrenal fatigue. All of these different diagnoses will be treated by treating those organ systems within the acupuncture paradigm, East Asian medicine paradigm. Some of them really, when it comes to the liver, gallbladder, these are difficult organs sometimes to clean out with the needles. It'll take longer, so herbs are very helpful in those circumstances. If you are dealing with the kidney function, I have herbs as well that can support this, as well as the needles are very helpful and beneficial. And we would also add something called moxibustion, which is mugwort, which is something out of Harry Potter, but it is an herb that you put in a bowl, and or you can do topically, you can actually do on the skin, you can do internally for different functions, but oftentimes you can do needlehead moxa. This is an herb that is placed on the needle, near the needle, on the skin, that activates the yang in the body. It helps to trigger what we call the Ming Men. It's the fire that ignites the movement, the activity in the body. And using the moxa, which has properties of reducing inflammation and helping with pain and warming anyway, it'll increase the effect and the function of the acupuncture treatment to do that. And I find it extremely beneficial. So those are the broad strokes. So when you think about your headaches and migraines, just know you don't have to just assume this is something that you have to deal with. Oftentimes people say, this is just what I've had. I've always had them, and this is what I have to accept. I got news for you. I've had people come in and they've suffered with migraines for 30 years, 40 years, and they think there's nothing I can do. We have treated them, we have cleansed, we have done acupuncture, we've done all the things that we need to do, and now they no longer suffer from that. They change their lifestyle, they change their diet, they figure out what it is that's triggering them. That's the beauty of the diagnoses of East Asian medicine, is that it gives us those little insights, those windows to be able to find and direct what is the cause, and then we can address them. So don't suffer in silence. Please stop reaching for the Tylenol and the aspirin. The aspirin will destroy your gut, and the Tylenol reduces your immune system, and the ibuprofen affects your liver. So just know they're there for like extreme measures if need be. Obviously, I'm partial because I just use herbs and acupuncture. I can't remember the last time I used any of those products. And I recommend that you consider what I'm showing you now so you can get to the underbelly and treat the real issue. And so get to your nearest East Asian provider to treat it and address it and be free of debilitating headaches and migraines. The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.